Welcome to Pathways. I'm Dr. Kate Hetherington. Howard Community College wants to ensure nursing and allied health students graduate ready for their careers. That is why the college has been on the forefront of simulation training. The college's high-fidelity, full-size mannequins give students experience in scenarios similar to what they'll experience in the healthcare profession. Simulation lets students practice their skills, ask questions, and even learn from their mistakes. Let's take a closer look at simulation in action.
All right, well, we're going to give you a little shot here. Ready?
We're able to have multiple encounters in simulation, whereas when you're in the hospital setting, whatever patients are available, those are the situations that the students are able to experience at that time.
As students first step into the simulation suite, they are introduced to the high-tech mannequins and a hospital room with all the equipment and supplies needed to simulate a real-life scenario.
So you can palpate a radial pulse in the right.
It looks like, it feels like you're in a hospital room. And so when the students are participating, they actually get in the mode of the real nurse, the real patient, and they react in the way that they would if they were in a real life situation. So we recreate that. Huge benefit. They are getting their skills. We have a safe environment. We know the skills that they are gaining, which is really huge.
Students take on different roles in the scenario, interact with the mannequin, and work as a team to solve the healthcare crisis. A facilitator serves as the voice of the patient and controls the symptoms of the mannequin. Students must investigate the patient's complaints and collect information to successfully resolve the situation.
For our students, that's really important when they're in the hospital. It's very unpredictable, the kinds of patients that they might see or some of the experiences that they would encounter. And so with simulated training, we're able to determine what those competencies and skills and those types of patients that they will see.
We're going to end your scenario now.
Once a scenario is completed, students are debriefed by their facilitator. This process allows them to evaluate their performance and identify the areas that need improvement. Bringing students together from different disciplines into a simulated environment is crucial to building communication and teamwork skills.
Big things that we're doing here at HCC is interprofessional simulation. And that's when we bring in disciplines other than nursing and have them learn together. So each discipline has their own goals for that student's benefit, and just as nursing does. And so the instructors come together, they plan the simulation so that it's mutually beneficial to the disciplines that are involved. And then when the students come together, they learn from each other. They learn about each other's roles, their responsibilities. They learn how to communicate with each other. And in many cases, prior to that, they don't really know very much about that other profession.
Working as a team, students develop an understanding and appreciation of what they need to succeed in today's increasingly complex healthcare workplace.
Once they come together, they have a different appreciation. They take that appreciation into the hospital setting. All of that goes with them as knowledge to help them interact across disciplines when they're in the hospital, because they will have to interact with all of the people that are in the hospital setting.